Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers, producer of Public Health on Call. Today, what it's like to be America's chief health diplomat. Loyce Pace is Assistant Secretary for Global Affairs at the U.S. Department of Health and Human Services. She's also a graduate of the Johns Hopkins Bloomberg School of Public Health. Today, she speaks to Dr. Josh Sharfstein about what she does every day, how countries hash out differences on global health issues, and why she has hope for the future. Let's listen.
Assistant Secretary Pace, it is great to see you. Thanks for joining me on Public Health on Call.
Thanks for having me.
So I want to start with a pretty basic question. You are the Assistant Secretary for Global Affairs at the U.S. Department of Health and Human Services. What is that job description?
Well, it encompasses quite a bit. A lot of people don't realize we have a diplomatic arm of HHS, but essentially any other work that you think of when it comes to diplomacy, me and my office are responsible for carrying out. HHS gets a lot of requests, inquiries, et cetera, from governments and other stakeholders from all over the world, and that comes into the secretary, and he passes it off to me and my team.
So could you give me some examples of what a day in the life would be like?
Sure. For example, we know that there are countries still dealing with mpox and wondering how to address that issue on the ground. They know that we have vaccine that we might be able to donate alongside other countries. And so they reached out to help understand how they could go about actually working with us on their response and perhaps even receive additional support, whether that be in the form of medical products, technical assistance, or otherwise.
So a country that is facing an outbreak and is looking for concrete help, you arrange that essentially.
Yeah, we do. We do that from our Office of Global Affairs, and it allows us to pull in Centers for Disease Control, the Administration for Strategic Preparedness and Response, or other parts of our department like the FDA or NIH and others who might be able to assist. Likewise, we might seek that assistance from other countries in some ways. Particularly during COVID, that was the case, but also given what we might be facing at any point in time, whether that's with regards to some outbreak or with regards to issues like cancer and other areas that matter to us as public health professionals in America.
So let's say there's an unusual infectious disease outbreak here, but one that's not so unusual in other places. You might be talking to the governments there about what they did, and is there information or even materials, medical products that they might be able to share to help us?
That's right. So think about that's making headlines these days with avian flu or H5N1. We're able to have conversations with Canada, Mexico, parts of Asia, and elsewhere who have dealt with this or on an ongoing basis.
What else? Any other major kinds of work that you do? Not that that's not enough. It sounds like a lot.
Right.
I'm just curious.
Yeah, no, I appreciate you asking for more here because it's not just this reactive role we play. That's certainly a part of it, the sort of client services role. But we also take a very proactive role globally. And we, in my office in particular, are the main points of contact for the World Health Organization. And WHO hosts a number of meetings or convenings throughout the year, in particular, the World Health Assembly, but then also the regional offices do a lot and have a lot of relationships, again, with the U.S. government, including our Department of Health. And so if and as we are engaging with WHO, either at an international or regional level, that's all happening through the Office of Global Affairs. So it keeps us pretty busy. In addition to that, we also serve as the point of contact with the G7, with the G20. And so again, anytime countries around the world are coming together to try and solve the world's health problems, that's typically going to involve me or my boss.
That is a lot. I'm curious what your priorities are. amidst all the things that you could conceivably be working on, when you are going to the World Health Assembly or you're talking to people around the G7, what are you trying to get accomplished?
Yeah, no, I love this question. The president came in on day one, and of course, that was in the midst of the COVID pandemic. And so we were absolutely focused on global health security and still have talked and tried to do a lot with regards to pandemic preparedness and response. But that's not all global health is. And I think, especially these days, as we're sort of coming out of the shadows and all that we endured with COVID, we're trying to get back to regular order. We're trying to remember also another commitment the president and the secretary have made around global health access and equity. And so we also talk a lot about universal health coverage. We talk about sexual reproductive health and rights. And we really get into the full spectrum of issues, including how health intersects with issues like climate or migration or other hot topics.
The World Health Assembly, take me there. What's that like?
Well, it's a circus. People have referred to it as the Super Bowl of global health or global public health. There are probably other ways to describe it, a carnival of sorts. But really, I'd like to think of it as, again, the world saying, look, we are trying to solve this problem together. We share some of the same problems, right? Whether we're talking about diabetes and heart disease, maternal mortality, or immunizations and how to get those back on track. And the WHO serves as an important meeting point for us to have those discussions and to really make decisions about the way forward. And that's important because you want the world rowing in the same direction when it comes to trying to solve these problems. When you have an outbreak, we need to come to agreement with one another with regards to what kind of information we need to be sharing, in what form, at what speed. Similarly, if you're really trying to dig into research in this particular area, again, we want to be clear on the questions we're asking and how we're each contributing to those answers.
I don't think I'm going to surprise anyone by saying that there are some serious disputes between countries in the world right now. And I wonder, when you're doing health diplomacy, whether it's sort of reflecting those disputes and divides, that there's sort of different camps of health, or whether it is an opportunity to overcome, or maybe not fully overcome, but at least temper some of those conflicts. How do you feel about the role of health diplomacy?
I feel quite confident about the role health diplomacy can play in building those bridges. Are they always easy to build or cross? No. And in fact, we've seen that. We've seen that in recent years, especially with regards to issues related to gender and health. And unfortunately, it seems as though we're pulling farther apart in that area. But then you have something like the international health regulations, which we were able to find consensus on this past World Health Assembly. The US set this marker a couple of years ago for the world to say, hey, can we improve on this framework? Can we make sure that if we face something else like COVID again, that we get it right, that we do better next time? And we did that. It wasn't easy always. But to your point, some of these issues and debates played out, of course, and that we would be able to respond when it came to its impact on health.
Interesting. The health regulations that you mentioned before, was that difficult to achieve? And what were like kind of the sticking points there?
No, not at all. It was smooth sailing, Josh. We had never done anything easier. Well, look, I mean, there are two negotiations happening simultaneously over the past couple of years. And, knowing your audience, they're probably tracking this quite closely. There was the pretty well-known set of negotiations on or towards an international agreement on pandemics, a pandemic accord, if you will. That is still to be determined, right? That is still ongoing, those negotiations. But at the same time, we were able to finalize these negotiations toward amending the international health regulations. And, I mean, the US really wanted to do some basic things, right? We wanted to make sure that countries were reporting to WHO in a more timely and transparent manner when they saw something, right? If you see something, say something, essentially. We wanted to give WHO permission to share the information they were receiving with other countries so we could respond or ready ourselves in kind. And there were a few other things we were asking to do, including figuring out ways to, frankly, build the capacity of countries to be responsive. It's not always for nefarious reasons that countries don't want to disclose. Sometimes they don't have the resources to even identify an outbreak, let alone understand it and report it in a responsible way. So the two go hand in hand, this idea of compliance and capacity. And that was a lot of the debate, really getting that balance right and making sure countries, particularly in the global south, didn't feel penalized or didn't have a disincentive for reporting. Obviously, it was important to think about ways these amendments to the health regulations would dovetail with any international agreement or accord. So that was also a big part of the debate. And there's, always outstanding issues with regards to financial resources or what to do in terms of enforcement and accountability, what happens when a country is not compliant ultimately. So those are the pieces that we had to work through, and some parts were, I guess, more straightforward than others, but everyone around the table dug really deeply to get there. And that was frankly the best part of this year for me, and maybe one of the highlights of my tenure in this position.
Sometimes you have to compromise.
Yes, often you have to compromise. I mean, the US, yes, we remain a leader in many ways in the world, and I think that's a great thing. But part of leadership is meeting people where they are and finding some, if not middle ground, some meeting point where everyone feels they're able to walk away with something that works for them. I think I've heard negotiators say something like, if everyone's a little bit unhappy, you're probably doing it right.
You mentioned Israel, Gaza, and the ability for countries to come together from a health perspective. What was the gist of that agreement?
So essentially, and this was revisited again this year, but it was essentially supporting WHO in their efforts to really, first of all, understand and document what was unfolding with regards to health facilities, health workforce, but also importantly, health status of civilians. And this was when things were not being as openly reported or understood in the first 30, 60 days. Now, of course, months later, everyone understands what is unfolding and the real crisis, not only in the health space, but otherwise, with regards to water and sanitation, nutrition, obviously access to care. These are all issues that it's important for WHO to document and understand, and then obviously respond to, right? And so with the resources they have, with the access that they can receive, WHO, with the permission of member states, can do what they can to support the response, the health response in Gaza. That obviously has been limited because of the security situation or the lack thereof. But there were notable moments, the ability of WHO to go in and try and save the lives of preemies that were at the hospital, and otherwise really waving the banner with regards to what supplies are needed on the ground to just provide, again, basic food, water, shelter. And that's, not just WHO, but other partners who have been working mightily to shine a light on the issue and do what they can to resolve it.
So, looking ahead in health diplomacy, are you optimistic? Are you pessimistic? What do you think are the major issues in your field? You've had kind of a crash course in how the United States intersects with the world on health. Where does that leave you?
I came into this as someone who always stood outside the tent, right? So I've been going to World Health Assemblies since, oh goodness, 2008 maybe. But as an advocate, as someone who was pushing countries to do more, right? To do more for more. And being on the inside has certainly been eye-opening. I remain hopeful about health diplomacy. Unfortunately, with every crisis comes opportunity, and just with the world having lived through this very prominent health crisis of COVID, we've been able to point to other ways that health is essential for global development and well-being. And so we have the world's attention. number one. Number two is there is also a very real understanding and maybe even an appreciation of the intersection of health and not just diplomacy, but the political environment. This is not just a bunch of, nerdy scientists like us coming together trying to solve the world's problems. Certainly, we need to be at the table, and yet health is political for better or worse, or can be. And so we need diplomatic engagement to ensure that science wins and give us hope in making progress on some pretty important priorities. I think that's what the future holds. I think it entails bringing and keeping more people inside this tent so that they understand the opportunity and value of health-centered discussions and negotiations, but also helping people understand how much we need to protect the health space as well and really resist any efforts or urges to pollute this space in a way that makes it ineffective. So that's the trickiest part. And I think that's the word of caution I would impart to anyone who comes after me or wants to come into this space is really getting that balance right. Because with attention needs to come action, of course, but there are also not so great actors paying attention to this space too, and working to dismantle a lot of what's been put in place, the progress we've made in HIV or child deaths around the world, the progress we're trying to make in mental health and other issues that affect everyone everywhere every day.
I hear you saying that science can offer solutions that can reduce an enormous burden of global suffering and death, but we have to find our way there to actually not only develop the science, but then be able to share it and make it available and stand behind it.
That's right. Innovation without impact is just a good idea. And we want to be sure those good ideas reach individuals.
It's just hard to appreciate how much is at stake, an awful lot. Well, Assistant Secretary Pace, this has been so interesting. Thank you so much for taking time from your travels to join us here on Public Health on Call.
Thanks, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.